Why don't we go ahead? It's just a little after 1. Why don't we go ahead and get started? I will start. Obviously, we are here after Friday getting some updated information from the CDC. Many of us have poured through that and spent some time really thinking about that related to how we can open our schools more fully, and just wanted to give you all an opportunity to be able to ask some questions. As always, I'll answer questions like I can for the county in ways that I think are a little bit more universal. And then there's some specificity every time we talk to maybe the way Greece might be handling something. And I'll just try to distinguish between the two because as we go forward, we know there'll be some difference with school district to school district. So with that said, why don't I just let you all ask questions?
Kathleen, what do you make of it when the state says, well, the schools have the authority to do whatever they want within the existing guidelines. It's not really us problem, it's a them problem.
That has been one of the most frustrating pieces about this whole situation since the beginning, that we have struggled with, because the governor has said that right from the beginning, and yet the way that the New York State Department of Health guidance is written, it doesn't necessarily leave us with a lot of flexibility in order to just open schools widely. So there is a disconnect. I think that's the frustration that we've had throughout. And I guess our hope, we still have work to do in that area because the CDC has issued this new guidance, but we haven't received anything updated from the New York State Department of Health.
Yeah, that was going to be my question. Do you just move forward under these CDC guidelines? Are you waiting for the state to say, yeah, it's okay? Or is it your understanding that you can just go full steam ahead if you can fit yourselves into this guidance from the CDC?
And this is where I'll be a bit cautious in saying, there may be some difference from superintendent to superintendent in terms of how we all handle this and what communities are comfortable with. I am moving forward at this point. I have said for weeks now that I want to be ready the minute that I can to get our kids back to school. So we have put a date out there in terms of April 19th, the beginning of the 4th quarter. I'm being really clear about that date because I really want to be clear in terms of our planning and preparation and just our readiness to be able to shift to that right away. And I'm doing that in some ways, knowing that there's some variables that are out there that I can't control at this point. One of the things in the CDC guidance, it talks about transmission rate, and that's that one factor that could change and is changing. Right now, our transmission rate isn't great in Monroe County. So that's a number that I want to see come down. That's a number that I know our public health officials would want to see come down, and that we have to continue to be vigilant related to masking and all the behavior over spring break. But I'm moving ahead like we're opening at this point. We're working on a specific plan that we'll be submitting just around our updated plan for reopening. So that's my hope at this point, and that's why there's a bit of squishiness to that people are uncomfortable with, but I feel like we have to move forward.
Who are you submitting that plan to?
Well, so back when we opened in the fall, we all submitted. There was pieces that we submitted to New York State Department of Health, and then also to the State Education Department. So we'll follow the same way that we did that in the fall, and resubmit with our updated plans. Is the way I'm anticipating doing it. So we're working on that in hopes of being done this week with a more formal plan.
And what does reopening mean exactly for you, Kathleen?
So for us, we're looking at, so I'm applying the 3-foot guidance. So I put communication out to our families on Friday last week, specifically asking for any families who want to return 4 days a week. So in Greece, it will be a 4-day week. Wednesdays will still be Wednesdays where kids will be learning remotely, and that's for a variety of reasons. But right now, 97% of the families who've responded to that survey want their children back in school 4 days a week. So that's what we're planning for. So that'll look different because what we're basically doing is taking the 2 cohorts and then any students who want to return from remote, and we're bringing them all back at once. The 3-foot piece will be challenging. That's what we're working on right now with our school teams. So we're looking at like where it's more troubling and difficult is at the elementary, where we have kids at tables and there's some furniture issues that don't quite work, particularly when you're trying to bring back 26, 27 kids into a classroom. So we have teams working on that. We'll be using swing space. We'll be using extra, support staff and other adults to help us with making that work in our physical space with those constraints. So there's a lot going on right now, and that's why that idea of that planning, like we have to plan, and it's going to take us weeks to get all of that right and to be able to get furniture back or shift out things, and then also change up schedules, because that's another piece to this.
Kathleen, what about, sorry, am I echoing? What about like teachers unions, your teacher union in Greece? Are you hearing pushback from some parts of the district that are saying we don't want to follow this 3-foot rule?
Yeah, so our unions, and this is different depending probably on where people are. Our union, we've been working really collaboratively with all along. So when I talk about our subcommittees, we have district-based subcommittees that our union has strong representation on, and then every one of our school reopening teams, that's comprised mainly of our teachers and representation from the teachers union. So they have a voice in all of this in terms of how things look. And by all means, they're being really careful around wanting to ensure safety and wanting to ensure voices are heard in terms of what things look like and how things are done. But they have been positive. They have been really productive. They've given great ideas. I just went back and forth with my union president last week around our communication, and he had some great suggestions. And they're advocating to just ensure the right things for our kids and for our teachers. So in my case, that's been really positive. I'm sure that depending on how people have involved their union, that could lead to maybe some different scenarios. But I think by and large, most of our teachers really desperately want the kids back too. And they've been saying that a lot throughout the year as well.
Is your sense that, and I know you can really only speak for Greece, but just on your conversations with other superintendents in the county, is your sense that most districts want to move forward and get this implemented within the next month or so?
I can say, and I can say pretty confidently from, we talk on a weekly basis as a group of superintendents, and we do that collaboratively with Dr. Mendoza. And I will say really confidently that our districts, in Monroe County really want kids back for the 4th quarter. Like that is, we're pretty united in that and in wanting that. So the logistics and how it all work and look, certainly there's some difference there. There's some challenges that are unique to different places, but by and large, I think we're all at the point where we really, we see what this has done to our children. We want to sort of bring some normalcy, get our kids back from a social emotional perspective, from an academic learning piece, just to be able to really take advantage of that 4th quarter, get kids back. And then really launch into the summer where we know we're going to have some additional work to do related to catching kids up this summer as well. If we can start now, it would be better.
Kathy, I spoke to some superintendents on Friday, and their biggest concerns were transportation and the lunchrooms. You are a big district, and how are you handling those? And what will it look like for parents who want to send their kids back?
Yeah, so transportation right now has been handled a little bit differently by different districts. In Greece, we've used 22 as a number. We're looking at filling our buses to 2/3 capacity. So we're looking at that idea, which is reducing the space between students. We're looking at making sure windows are down. Obviously, there's some things that we can do to mitigate. We're looking at making sure siblings are sitting next to each other. So so that almost kids are potted on buses. So there's things like that that we're doing that will take time. And that's one of the things with the information that I shared on Friday with our families. We're getting that information right now so that we're set by Thursday of this week, and my transportation department will have over 2 weeks to really get all of those details sorted out. And then we can communicate with families about that. So transportation is going to look differently. And then I know some families are choosing to drive. So that's another piece that we're working on, is what does arrival and dismissal look like? Because it really changes the dynamics of a school when you have double the amount of families coming and dropping off in a loop. Like there's a lot to really sort out with that. So those are things we're working on right now in terms of plans. And those are pretty big challenges. The lunchroom is another one. So lunchroom space right now, whether that be adding lunch periods, whether that be looking at identifying other spaces, classroom spaces, and other places to eat. There's a lot of things being sorted out. And again, I really rely, because we're large, on our school teams, because our school teams have the people on those teams that are living that day to day. So the support staff and the teachers and the administrators from that school who can work with the actual numbers and figure out how to make that work.
Kathleen, how does the federal stimulus money come into play, whether for this year or for next year?
Yeah, so the money that that's has me really hopeful in terms of the dollars that have been earmarked, and it's specifically looking at learning loss. There hasn't been a lot of specificity in terms of what counts. So I think about that, and we're thinking about that related to supplement versus supplant. We're looking at it in terms of what are some of the things that we're already starting right now in terms of trying to catch kids up and address learning loss for the fourth quarter. So we're trying to think big picture around sort of how we're going to be able to spend those dollars. But again, a lot of that is going to be some of the costs that we've just incurred because of COVID, like some of the more concrete items. But I think for us as superintendents, the biggest challenge will be to think about creative and innovative ways to really address learning loss and closing the gaps that we know we have with our kids. And that could be, Justin, that might be, so I think about, I'll just give you a couple examples. Sorry, I should have, like right now, for example, we have a Twilight Academy that services kids after school, where we're looking at sort of like mastery and trying to close gaps with key standards. We have Saturday programs, we have summer programs, we have things that academic learning centers that run throughout the day in our schools. So there's a lot of structures like that that are costly, that not only do we want to run now, we're trying to start that right now, but we want to be able to sort of run all of those and probably add on because we're going to have more students. So the program will need to be expanded in many cases at all of our schools.
Kathy, for parents who just aren't comfortable sending their kids back, there are options, but how do you manage that? Will those kids now be handled by a certain set of teachers, or will they be interactive in their classrooms as if they were there? What is the plan for those families who maybe aren't ready to send their kids back yet?
Yeah, that's been an ongoing question for all of us, and from school district to school district, that's handled a little bit differently. So right now in Greece, our teachers teach in a hybrid way, meaning they have some kids in front of them every day. They have some kids who are in a cohort that's not at school, but maybe participating online. And then they have some kids in their class that are fully remote students who never step foot in school, but are assigned to that teacher. So those students are still going to be assigned to a teacher. One of the things that is a concern related to as we figure out how to manage everybody coming back is in some cases teacher rosters are going to change a bit. So for example, a teacher who might have been a fully remote teacher, we had some of those too. If all of their kids come back, I'm gonna need to assign that teacher different students. So there's some complexity to all of that. I would say if parents aren't comfortable, which we know we do have some who've indicated that they want to stay into a remote model, They will most likely, they'll probably stay with the teacher that they have had all year, but there may be some instances where there might be even a change of teacher for the fourth quarter. But they would be getting their instruction online like they have this year. There's some difference. I mean, there's a lot of different scenarios that could happen in there. So that's a hard answer or a hard question to answer, because it'll look differently from district to district, and it even could look differently in Greece in different places, depending how numbers shake out and what happens at a grade level or with particular teachers.
Kathy, what about bringing students back in who have been learning remotely, but now are going to be re-entering the classroom for the first time? Do you expect there might be, I know teachers really doing a good job and the best they can, but there might still be a gap from kids who are in the classroom and have been throughout versus kids making their first return to the classroom? Do you anticipate that being something to overcome?
Yeah, we've been doing that all year. So I think about mid-year in February, we brought back 800 students in Greece, which was this really sort of amazing thing because if you talk to principals and teachers, it was like the first day of school at mid-year this year, because we had so many kids sort of coming back because they were feeling more comfortable with the idea of being on campus. And our teachers did notice a difference, you know, so you've got kids who, particularly like little ones, who've never been in a school setting, who needed to like relearn or just learn for the first time, you know, where to find things in their school. How do we do lunch? Where do we go for this? So there's work associated with all of that on teachers' part. That's the empathy piece that, you know, this is not, this has been a change for teachers all year long. At every stage of this game, we've asked them to change and adapt and learn something new. And then just as they get comfortable, we sort of change things again. So there is definitely truth to that. There's work associated with that. And that's also, you know, I keep saying we're at the end of the marathon, we're getting there, but I also want to just be mindful of the fact that it will slow them down a bit. You know, if all of a sudden I'm bringing 2 cohorts together and I've got 6 new students now joining the group, there's some new training and teaching and things that have to be done with that group just to get people up to speed for sure.
I just want to clarify one more time, Kathy. So in your conversations with Dr. Mendoza, you're not worried that anyone's going to stop you from reopening as you go down this path, right? I mean, I know we haven't gotten any specific guidelines from the state health department, but it does seem that they're indicating to superintendents in some cases, I've had some things forwarded to me that they're going to sort of fall back to the county health departments. So you believe it's okay to go full steam ahead and no one locally has told you otherwise?
I will say, you know, that's a tricky question. And that is like at the root of what makes everybody in this scenario not perfectly comfortable, because there is transmission rate. When you look at what people have said, you know, people are identifying the transmission rate as being a key factor, and our transmission rate isn't perfect in this area. We're still considered high or red. So, and we have seen some improvement of that, you know, over the last several months. So, you know, I'm assuming that there's still going to be some oversight to this. So as a school district superintendent, I'm moving forward. I'm going to be working on a plan. I'm going to follow the rules in terms of submitting it. I don't know, could the New York State Health Department stop me and say, no, we're not approving this plan, you don't meet the criteria? Like that probably could happen. So I should be realistic and honest about that. Like I want to make sure that that's clear. I'm not the end all be all. Like there's people that I do report to. So I would imagine that that could happen. Dr. Mendoza's point throughout all of this is he was never the person who reviewed our plans. Dr. Mendoza has worked as a guide for us. He's helped us to think through things from a safety perspective. But I never handed my plan in to the county health department. I handed my plan into the New York State Health Department and the state education department, which is what we'll continue to do going forward. And the transmission rate piece, like I said, along with all those other factors that we continue to make sure that we do, are part of the equation. So I'm hopeful that we'll see things trend in the right direction, that we'll see people be really responsible over spring break. so that transmission rates continue to head in the same direction and decrease, so that we can open schools fully. That's, I mean, ideally what we all want. But it's still on us as a community, because if, for example, spring break goes poorly and rates across the country go up and rates across Monroe County skyrocket, that's going to really harm our ability to go forward.
And speaking of that last point, and then I'll stop hogging all the questions, but spring break specifically, I asked Dr. Mendoza about this last week. He said, listen, I know people are wanting to get out. They want to do it. The state rules say after April 1st, you don't have to test and quarantine. But are you, as a school district, moving forward under those rules? Are you asking families to provide any additional information, or teachers? How are you handling spring break?
We're following the guidance. So after April 1st, we're just going right back to that same guidance in terms of after April 1st. So no, nothing more after that. Any other questions? Okay. Thanks, everybody.
Kathleen, I got one question that's not, it's just out of curiosity.
Sure.
Are you still going to be in your current role as president with Monroe County Superintendents, or is that changing again? Because we're almost on that 1 year.
I'll tell you, I feel like it's like a dog year. My 1 year of service equates to like 7. I'm counting. So
I feel like you're right.
yeah. So as we transition to the new school year this summer, Bo Wright from Rush Henrietta will take over as president, and I'm done. Done. Gratefully, yes.
What a
You
year
guys have somebody
to
more
get this.
to talk to.
We'll
No,
miss you,
I mean for
Kathy.
you, right? We'll miss you, but yeah, what a year, huh?
Yeah, it's been a year. Certainly been a year.
All right, take
Right.
care.
Thank you,
Thank you.
everybody.